So welcome back everyone to another episode of the Strength Doctor channel. In today's episode, I'll be discussing about the anabolic steroids, and this is the most awaited video and the most interesting video I'm going to do of the supplement series. So stay tuned and keep watching.
I'll be back.
So now, what are anabolic steroids? Anabolic steroids are drugs that help the growth and repair of the muscle tissue. They are synthetic hormones which initiate the male sex hormones, especially testosterone. Now, anabolic steroids have some legitimate medical uses as well. They include treating hormonal issues in puberty or treating muscle loss caused by diseases such as autoimmune disorders or cancer. Now, some people may use anabolic steroids for non-medicinal purposes, including lean muscle mass gain, strength improvement, endurance improvement, overall fitness improvement, and that is what I'll be covering today. So now, how do these anabolic steroids work? So basically, the working mechanism is such that these hormones, the steroid hormones, they work by stimulation of the receptor molecules in the muscle cells, which activate specific genes to produce proteins, thus enhancing the protein synthesis and inhibiting their degradation. So here's a picture, as you can see. Here the anabolic steroid is crossing the cell membrane and binding to the hormone receptor and causing changes at a DNA level, which is helping in production of new muscle tissue. Now, speaking about how it helps in muscle growth and what you need to do in order for it to work. So basically, heavy resistance training seems to be necessary, which is obvious, I think, for anabolic steroids to have any beneficial effect on physical performance. So most research studies that have demonstrated improved performance with anabolic steroids were in weightlifters, highly experienced weightlifters who were capable of training with much heavier weights and producing relatively greater muscle tension during their exercise than the novice subjects. So the effects of these hormone or the steroids are more in advanced lifters than that can be seen in a novice. Now, the effectiveness of this steroid is dependent upon unbound receptors present in the site of the muscles. So it doesn't just mean that if you take it, then you will suddenly just become huge or you'll become stronger. Definitely you will become stronger, but that doesn't mean that you will be better than another person who might be using the same. It totally depends on the amount of unbound receptors at the site in your muscles. So the intense strength training may increase the number of unbound receptor sites. That's why, as said, that heavy training will be beneficial, and this would increase the effectiveness of these steroids. So now, talking about the anticatabolic effects of anabolic steroids. Anticatabolic meaning the prevention of breakdown. So anabolic steroids may block the effects of hormones such as cortisol, which is a stress hormone, which is involved in tissue breakdown during and after the exercise. So cortisol and the related hormones secreted by the adrenal cortex also has receptor sites in the skeletal muscle cells. So now the cortisol causes protein breakdown and is secreted during exercise to enhance the use of proteins as fuel and to suppress the inflammation that accompanies the injury. So anabolic steroids may help in blocking the effect of cortisol and its binding to the receptor sites, which prevents muscle breakdown and enhances recovery. So now talking about the benefits or the effect, more than benefits I'll say, like the effects on the performance of the athlete. So the anabolic steroids in studies, they have shown beneficial effects. They increase the body weight by an average of about 4 pounds or about around 2 kilos or 1.8 kilos. So now what happens is that the lean body weight also increases and by about 6 pounds. So fat loss accounts for discrepancy between the gains in lean mass and body weight. So now in the lifts which the studies were conducted, suppose for bench press, it was seen that about 15 pounds of weight was added on your bench. So 15 pounds comes out around about 7 kilos around. So 7 kilos, and on squats, they added about 30 pounds. So that is again around 13-14 kilos. So now most changes in strength during the early part of the training are neural. So it's basically neural adaptation, that is your CNS gets better adapted, and increased strength is mainly due to an improved ability to recruit the motor units, as I said. So anabolic steroids also affect the processes associated with protein synthesis in muscle, as discussed before, and studies lasting more than 6 weeks would largely reflect neural changes and could easily miss the cellular effects of the drugs. So now what is happening in this is that the studies are usually conducted for a period of about like 6 weeks or 12 weeks. So that is not a sufficient amount of time to gauge the proper effects of the drug. So mostly what we are able to study are the neural effects or the CNS effects of the drug rather than the cellular effects of the drug. So the gains made by athletes in uncontrolled observations have been much more impressive. So these include your advanced lifters, your sprinters, or your other like cyclists and all those other athletes which are using them from a long period of time. So there's about 30% increase in strength, and that is very common among these people. Now, although the effects which you heard now may seem very enticing and may seem very attractive to the ear, but this can also backfire and usually does backfire. How it backfires is that while this is beneficial, while the athlete is taking the drug, the effect backfires when he stops taking it. That's when the game begins. So hormonal adaptations occur in response to the abnormal amount of male hormone which is present in the athlete's body. So cortisol receptor sites and cortisol secretion from the adrenal cortex increase. Again, as I said before, the adrenal cortex will again get stimulated as the athlete goes off the drug, and there will be a hyper response. So the anabolic steroid use will decrease the testosterone secretion as well. So people who stop taking the steroids are also hampered with less male hormone than usually which is produced in the off period. So basically your natural capacity to produce those hormones will also reduce, thus causing a loop of problems for the athlete. So the catabolic effects of cortisol are enhanced when the athlete stops taking the drug, and the strength and muscle size are lost at a very rapid rate. Now the rebound effect of cortisol and its receptors presents in people who use anabolic steroids with severe serious problems. Now there can be psychological addiction, which is more probable because they become dependent on the drug and its effects. It causes a sense of euphoria among the athletes that they are in their high performance and everything else. So now what happens is that to go off that deconditioning, the athletes may want to take the drug again for long period of time, so as to not fall behind or have that feeling of falling behind. So now long-term administration will increase the chances of the side effects which occur. So this also suppresses, now the cortisol also suppresses the immune system. So what happens is that after the athlete is off the drug, cortisol response is much higher and it will suppress the immune system as well. So this makes them, the steroid users, to be more prone to diseases such as cold and flu can also take action more rapidly. And the period, this is usually seen in a period just after the athlete is off the drugs. So now coming to the interesting part of the video, which I think most of you might be seeing it for. So I'll be discussing about the various steroids which are present in market. So I'll be talking about their uses, their side effects and their dosage. Now a disclaimer before I begin is that these dosage are all generalized. So it's not specific for anyone. So I would recommend that no one follows this as a regime if they are, in case they are wanting to use. And this video should not be used as a guide to use those drugs. It is just an informational video and it is for your own knowledge, and any use will be up to you. So now talking about the first drug, that is the Oxandrolone, also known as Anavar. That is the common market name. Now Anavar's use is basically to reduce the muscle loss, and it is also used to reduce bone pain in people with osteoporosis. So now Oxandrolone will not enhance your athletic performance, but it will just help you in reducing the muscle loss or the catabolic effects. So the side effects that occur with this are acne, shortness of breath, impotence, liver problems, loss of appetite, dark urine, clay colored stools might also happen, and high levels of calcium in your blood can cause vomiting, stomach pain, constipation, increased thirst or urination, and there can be muscle pain and joint pain also. Now the dosage, which is the generalized dosage for it, is about 2.5 milligram to 10 milligram. Now talking about the second steroid, that is Nandrollon dicayonate. Now Nandrollon dicayonate, the results show that the administration of about 200 milligram per week of this intramuscularly for 8 weeks will show significant increase in body mass and fat-free mass. Now the fat-free mass can be bone mineral content, bone mineral density, as well as, and the hydration of fat-free mass is also unaffected. So basically your bone mineral density and your bone mineral content might increase. Now these data indicate that the changes can be attributed to also with increased muscle mass as seen. So the side effects are again acne, bladder contractions, and breast pain, enlarged breasts, gynecomastia in males. Now talking about the third steroid, and this is the most famous and the most commonly available and most popular steroid, also known as Nandrollon. So Nandrollon, also commonly known as Danabol or D-bol, it is a popular steroid, one of the oldest used and available in oral forms. So it provides great amount of muscle gain, promotes fat loss, improved endurance and stamina. It also increases blood nitrogen levels, so metabolic rate increases, blood flow is increased to the muscles, and increased muscle protein synthesis is also seen. Now the side effects with this can be gynecomastia, blood pressure increase, fluid retention and edema. Also liver damage and excessive body hair growth is also seen with this steroid. So the dosage used for this commonly is 30 to 50 milligrams a day for not more than 1.5 months. So that is the around 1.5 month cycle, you can say, of D-bol. Now coming to the fourth steroid, that is Stanozolol. Now Stanozolol is a special one. It is useful during dieting. It increases the lean bulk. It improves the definition in bodybuilders. The conversion to estrogen is negligible, so it's highly ideal, and it allows steroid stacking effect because of decrease in SHBG. SHBG is sex hormone binding globulin. Now to keep it simple, steroid stacking effect is an effect where you can use multiple steroids and have their cumulative effect on your physique or on your development. So basically this is not to be used by a beginner who is just starting on his cycle. It is used in a more advanced bodybuilders in more advanced stages of your cycle, and it helps in using multiple steroids at the same time. And also, as I said, that the estrogen conversion is negligible, so it's very, very ideal and highly used for competition prep, and especially used during the peaking phase, that is during the pre-show, like when you are about 4-5 weeks out. I don't know the details much, so I won't be speaking on it, but yeah, it is used during the cutting phase of the cycle of your physique. So now coming to the side effects that occur with Stanozolol. So with Stanozolol, the side effects are headaches, cramps. It's the LDL levels may increase. Again, high blood pressure, elevation of liver enzymes, then prostate growth, hair loss, liver damage, and increased risk of stroke, heart attack, and body hair growth again. Now in women, there can be hair loss and deepening of voice can also be seen. Now talking about the fifth steroid, and you might have, it's a very popular one and you might have heard about it a lot. So it's Trenbolone. So Trenbolone is used for increasing muscle mass, performance with no water retention, improved muscle quality, and the thing with this is that it's a potent, highly potent steroid, and it was used in cattle also. So the usage of this is not recommended in a novice bodybuilder or a novice athlete. It's mainly used by more advanced athletes or the people who are more used to a steroid cycle. So it's basically the usage of Trenbolone comes later. It's not supposed to be done or used at the beginning of a cycle, or beginning if you are a novice, if you're going first time on your cycle. So you should never use Trenbolone. It's a highly potent steroid, and it can cause lots of side effects if your body is not used to it. So the side effects can be night sweating and insomnia, and as discussed in the other steroids, it's the similar side effects occur with this. Now the dosage is of two types, that is solo and combined. So solo is taken for 10 weeks, and for 4 weeks 100 mg is used, and for the next 6 weeks 200 mg per day is used. The combined dosage I won't be talking about because it involves the usage of other steroids as well. So I am not equipped enough to guide you on that process or to talk about that process. So I'll be sticking with the solo dosage only. Now the last steroid, that is the sixth steroid which I'll be covering, is Trenbuterol. Now Trenbuterol, as you might have heard it's a slang like eat clean, train hard and never give up. So this one is Trenbuterol, is Clen, also known as Clen commonly in marketplace. So it has been observed to increase both muscle mass and reduce body fat. And additionally, it remains in the body with an active effect for up to 6 days after consumption. So it can be like its traces can be detectable much longer after its usage. And because of these properties, it's often used as a weight loss supplement or to enhance athletic performance. And athletes need to be very careful of its usage because as it will appear in your blood work later on. So during testings, during dope testings, this can be a major cause for failure of dope tests. So it again causes increased heart rates, tremors, anxiety, electrolyte imbalance is also seen, and the other steroid effects as discussed above. Now the dosage for it is very less. It's about 0.06 to 0.12 milligrams a day. So this was the last steroid I had covered, and as a note of caution, again I'll be telling you that whatever I have discussed in this video is purely for educational purpose. This should not be used for practical purposes, and you should and definitely talk to your physician before going on any cycle, or talk to your local or your pharmacist or your coach prep guide. So it is better, they are much more equipped and better informed about your body and the practical usage of them. I have covered the theoretical aspect. So with this note, signing out, the Strength Doctor, and maybe the next time I'll be talking about post-cycle therapy, or there's another thing, another new trend that is coming up, that is the on-cycle therapy, which I recently saw in a Larry Wheels video. So that was pretty interesting. So maybe I'll be talking about that too. So stay tuned and keep watching.